There we go.
Amazing. Hello, everybody, and welcome to this episode of Connected Conversations. Bariatric surgery. What does long-term success look like? I am super excited about this conversation with our guest today, Dr. Judy Shao. And I'll introduce you guys more to Dr. Shao. She's a medical director of the Leaf Medical Weight Clinic, pardon me. So I'll introduce you, give you a little more context in a moment. But just as a reminder, for those of you who may or may not have enjoyed a Connected Conversation before, Connected Conversations is a monthly series brought to you by Obesity Canada. And it's in these conversations that we really try and get into the heart of the matter and really dig into important topics for people living with obesity and also connecting with experts out in the field. So we like to touch on everything from advocating to access to evidence-based treatments to issues related to diet culture, weight bias, and discrimination, all of those things that we're constantly being bombarded with. And also, more importantly, let's talk about innovating obesity care in Canada. Connected Conversations really tries to take these complex things, break them down into human-based conversations, and keep the conversations going from there. So if you haven't met me before, my name is Lisa Schaefer. I'm one of the hosts of Connected Conversations. I'm a patient advocate, and I am also a member of the patient community. Professionally, I'm a marketer. I live in Vancouver, and it has been my absolute pleasure for the last 5 years to volunteer my time and talent to Obesity Canada in really trying to work on public engagement, work on advocacy, and really trying to change this conversation, because this is such an important conversation to me personally, and I think society really needs to catch up and really understand that this has been a highly stigmatized, misunderstood, and misrepresented illness for a really long time. So my partner in crime, as ever, is Dr. Ian Patton. So Ian, I'll let you say hello.
Sure. Thanks for that, Lisa. And hi, everyone. Thanks for joining us today. I'm the Director of Advocacy and Public Engagement for Obesity Canada. I've been with the organization. I started as a student and trainee during my PhD many moons ago. And for the last couple of years, along with Lisa, have kind of shifted gears and focused towards this patient advocacy side of things. That we've been working on together for the last little while. So like Lisa, I'm very excited about this talk today, and I think it's going to be a really good one. This is definitely a topic and an issue that we get a lot of questions about from our community, our OC Connect community. And so I'm sure we're going to get a lot of follow-up questions and maybe some other avenues of discussion that we're going to have to explore after this webinar is done, which is always good. Just a little bit of housekeeping. So this particular Connected Conversation webinar is we are recording this prior to our actual event date. So we will not have the live chat feature or the live questions during this, but I don't want to discourage you from actually utilizing the chat or the Q&A feature, because we do keep track of that. We take those questions and we can either respond to them outside of this webinar, or we can use them for future events or future educational opportunities. So please utilize the Q&A feature, utilize the chat feature, and we'll make sure that we monitor those as well. So.
All right, yeah, we'll tuck back in and we'll connect all these dots. So I'm excited. I can remember myself, 7 years ago, really trying to understand bariatric surgery, trying to understand if I thought it was going to be for me. So I'm putting on my backwards pants a little bit and trying to remember that space that I was in, because I know I had 1,000,005 questions. We probably won't get to all of those kinds of questions, but I think we'll have a really awesome conversation today. So as I said before, our guest is Dr. Judy Shao. She is a general internist and the medical director of the Leaf, why can't I say this one today, you guys? Leaf Weight Management Clinic. Thank you. A community-based, multidisciplinary academic bariatric clinic in Ottawa. The key principles of Leaf: live, eat actively forever, I love it, are to help individuals live rich and meaningful lives while managing long-term weight. Leaf specializes in empowering patients to engage in key behavioral skills of weight management and complement their care with effective medical treatments. Treating people like humans. I love it. Dr. Shao is an associate professor of Division of the Endocrinology and Metabolism at the University of Ottawa. She's also the program director for the Bariatric Medicine Fellowship Program. And in this role, she trains the next generation of physicians Thank you, on how to best help their patients living with overweight or obesity. Dr. Xiao also lectures to second-year medical students as part of the obesity medicine curriculum at the University of Ottawa. And she was the lead author of the Post-Operative Management for Bariatric Surgery chapter in the 2020 Canadian Obesity Clinical Practice Guidelines that were published in the Canadian Medical Association Journal, and really is at the root of so much of what we're doing and how we're trying to inspire these conversations. So that was a lot of jargon to say hello to you. Would you like to introduce yourself in a more human way and just let us know a little bit about yourself?
Oh, thanks so much. I think you summarized my career in a few sentences there. My background is general internal medicine, and I've been practicing bariatric medicine for 20 years now. Wow. And so I've seen, the advancement, and it's amazing, particularly your association, how much people are now understanding how obesity is a chronic disease. And that in itself should alleviate some of that stigma and weight bias that exists. But on the other hand, we know it's not an easy battle to go through. Personally, I'm a mom also, so just in case you're interested. And,
love it.
And unfortunately, we had to record today because I'm heading off on vacation during the time that the actual viewing of this webinar is. So that's why it's a recording and not live.
Oh, good. We believe in living juicy lives here, so let's make way for vacations as well. But as Ian said at the top, this is such a great and big conversation and topic that we hear a lot about in our community. I think there's definitely a lot of misunderstandings about bariatric surgery, how it works, how it fits into long-term obesity management. As you mentioned, we know there's stigma associated around this as well. I know that was one of the things for me, just even the idea, like, do I need to take that extreme of a measure, was part of the narrative that was inside my head as well. So there's lots to unpack here. But I think it's really important to have this kind of conversation with someone who's working on the front lines in this area, because you can help us speak to that bigger picture of obesity management from a doctor and healthcare practitioner point of view. So what led you into this interest in working in the area of obesity medicine? And maybe tell us a little bit more about the work you've been involved in, like the CPG work, as well as a little bit about the Leaf Clinic.
Oh, yes. So as a general internist, and for those who don't know what a general internist is, we're pretty much specialized in anything non-surgical in adults, like a pediatrician is for kids. And in early 2000, I actually joined a cardiology group, and they hired me as the first female general internist to take care of things like diabetes, hypertension, lipids, etc. And within 6 months of being with that group, I actually approached the director there, and I said, well, a lot of this is weight related, and I wonder if you send people anywhere for weight management. And his answer, which was a turning point in my life, was essentially, nowhere. Do you want to start something? And that is how my bariatric career started. And this is the journey I've had over the last 2 decades, which is, thankfully, with his support, got some funding to work with a great dietitian. We developed a program that was more one-on-one in nature. And then we also had pharmacotherapy options, a little bit more limited at the time. Obviously, things have grown now. And then eventually, I joined up with the Ottawa Hospital. I'm based in Ottawa, and had great pleasure meeting my mentor now, Dr. Dent, who was also head of a meal replacement program at the Ottawa Hospital. And also, we were starting off with having bariatric surgeries as OHIP, Ontario provincial funded programs. And so I got to be part of that birth process. So that's pretty much how I've expanded my career from not only medical management, but also to programs involving plus or minus meal replacements, and then going on towards the surgical option. We had the best of all the worlds in, I would say, like 2013 to 2015. And then in 2015, as does happen a lot whenever you have funding for things, there starts to be limitations on the funding. And so with that, we saw at the hospital, and nothing wrong with the hospital, they have to go within their budget. But then they started saying, you know what, we can only see these patients for a couple of years. We can only see these patients for 1 year. You've got to start discharging people. You can't see them long term. And this is difficult for weight management because, as you know, this is a chronic disease. And hospitals are meant for acute care, not necessarily for chronic care. So that meant really going out into the community. So myself and Dr. Dent, we looked into it, and we actually then founded the Leaf Weight Management Clinic. And that is where we're able to see in the community people long-term. We don't have funding, so this is all kind of a mix of physician, OHIP covered services, and also programs with wonderful, like I have the best allied health team, dietitians who are trained in bariatric medicine. And unfortunately, there's costs for our programs, but that's the only way we could balance things out. But we do our best. You know, if someone can't do a program, they just see the physician, and at least they're OHIP covered. And during all this time, the discharge policies for people who had bariatric surgery occurred also. So now we see a fair amount of people who are 2, 3, 5 years out of surgery, and various things occurring. One particularly hot topic I know we'll discuss is weight regain. And, you know, this is something very serious. So people go through this huge effort of an intensive surgical option. And what's next, right? Where are your resources?
Oh, that's so huge. You've tipped onto something that I could just spend another hour talking about as well, because it is, you know, we are known as a cohort of people that have walked around the world with a lot of shame. And that is just like such a compounding moment of shame, or at least it was for me. You know, that feeling of regain after having surgery and feeling like I wasted my one term also was a lot of the narrative inside my head. Anyway, that's a bit of a tangent, but I appreciate that you have that lens to it, and that's a component of what you guys are working on. And it sounds amazing. I had the benefit of having exposure to a similar program in Richmond that had those different multiple disciplines around it. And I really do think it's worth its weight in gold for sure. But as somebody who runs a specialized obesity management clinic, you work with patients who will have, many patients who might possibly have the surgery. Can you give our audience just a bit of an overview of bariatric surgery itself, how it works, what does the process look like for an individual who's interested in exploring it as a treatment option, just even in a general broad sense, because we know not everybody's going to be able to get to Ottawa.
Right. So I think let's first define what bariatric surgery is. I think there's a lot of people kind of know, but then they don't know. And traditionally, bariatric surgery is making the stomach smaller in some manner. And, you know, it has been viewed in the past as, you know, divided into a restrictive, meaning, again, you have a smaller stomach, or you have a hypoabsorptive component, meaning that you're bypassing a tract of the intestine. So you kind of divide it into those means of mechanisms of how does a person lose weight with bariatric surgery. That being said, now we have this wealth of research about how bariatric surgery can help beyond just that kind of restriction and malabsorption. We know that there are changes in hormone signaling, gut hormone signaling, changes in hunger signaling. There's changes in bile acids, there's changes in gut microbiota. So there's a whole, it's complex, right? But that being said, these are powerful tools. So, but if we look back at the old way of looking at it as restrictive or hypoabsorptive, one restrictive procedure was the laparoscopic band surgery. And I still get asked about that frequently enough. I would say in general in Canada, it has never been in any province that I know funded. So it typically was something that was done privately, and essentially involved putting a band around the stomach, and then you pump the band up to tighten it. And that was just a means of making the stomach smaller. But, and you might know some people already who have done well on it, etc., but the majority of people haven't. So this type of surgery is no longer a surgery that is recognized by bariatric surgeons, or really, I think, rarely performed, if ever, anymore. So when someone is talking about bariatric surgery, big X, definitely not talking about the laparoscopic band surgery. The restrictive surgery that is pretty well known is something called the sleeve surgery, where basically the stomach is cut to the point where it becomes just a tube. And this surgery actually has become quite popular because it doesn't involve cutting up the intestine and, trying to bypass a section of the intestine. It's really just making the stomach smaller. And initially, it was a surgery that was viewed as part of the first stage of maybe the next stage. So someone who might have been considered higher risk for more intensive surgery, and they would say, oh, let's just do the sleeve. But then it turned out people lost weight pretty well with the sleeve. And so this is now actually a pretty popular surgery and might be the #1 go-to for some provinces. For the ones that have a hypoabsorptive component, they usually also have a restrictive component too. One that is really well known, particularly in Ontario, is called the gastric bypass, or the Roux-en-Y, where you have a smaller stomach, and again, you're bypassing a tract of the intestine. Then you have a more malabsorptive component called the duodenal switch, meaning that you're bypassing an even longer tract of the intestine, so there's a higher malabsorption rate. So both of these surgeries, when you have a malabsorptive component, you tend to lose a bit more. So when I'm talking about weight loss with bariatric surgery, the range can vary between 20 to 40% of your weight. So 20% of your pre-surgical weight could be seen more originally maybe with the lap band, maybe more 25% was the sleeve. And then you go up a little bit higher when you have the gastric bypass. And then you could potentially hit the 40% with the duodenal switch. But here's the thing. When you have a hypoabsorptive component, you also have the potential for some more complications. These don't have to be bad complications, but you need to be aware of things regarding these type of hypoabsorptive surgeries. But if you're looking for the stronger tool, then you're looking at those surgeries that include that bypassing a tract of the intestine. So I've just named a few surgeries, but that doesn't mean that might be the surgery that's available at the site of your interest or the site that you've been referred to. And that's sometimes a difficult thing because patients are great at Dr. Google and they will look things up and they will say, this is it for me. This is exactly what I want. Do that on me. And perhaps the site can't do it because that's not something that they would typically do or have been trained in. And so the point being is surgeries exist. They are there. This is a conversation that has to be made between the patient and their surgeon and the team that's involved with that hospital that's doing the surgery. And then you make an educated decision of whether or not this is the right thing or step for you.
Yes.
So that's just a quick overview of the types of surgery. I think you asked what to expect when you're going through that.
Mm-hmm.
Yeah. So I think you lived it too. There's such a thing called a wait list.
A little bit.
And a wait list can be horrific. You don't know. And every province is different. So in BC, like they'll do 500 surgeries in a year versus in Ontario, they do 5,000 surgeries in a year. So the wait list will be different. I think one of the things that happens when a person decides they want to pursue bariatric surgery is they have to be patient.
Yes.
And not necessarily think that, oh, in a year or two, when I get the surgery phone call to get started, that it will happen the next day. It's still a process. So while you're on that wait list, you can still do things to help manage weight. And we can talk about that a little bit more later. But once you start the surgical process at wherever site that you are at, it's really important to recognize that the team that is there, and I hope it's a good team, okay, but in general they are, and I know particularly like the provincially funded ones are good teams. Like they really work hard in making sure that a person who's going for surgery is ready. And that's the thing. They're there to help make sure that you're ready to take advantage of whatever surgical treatment you wind up getting. And so you'll hopefully meet people like a great physician, a great surgeon, great allied health, working with a dietitian, a kinesiologist, you know, social worker, behavioral therapist, psychiatrist. There might be group sessions, there might be one-on-one sessions. There'll be a lot of prompting and trying to make sure that you build those skill sets. In particular, things to make sure that you are comfortable with, because putting into practice, as you know, is kind of what we need to do to get used to doing things for post-surgical weight management, is to have regular meals, you know, 3 to 5 meals, good protein content, practicing things like eliminating caffeine from your diet, because the caffeine can irritate the stomach lining post-surgery. Alcohol has to be reduced, building physical activity, learning mindfulness, learning some CBT. You know, if you're an emotional eater, that's not going to be fixed with surgery. So these are the things that the team at the hospital or the site where you're having a surgery are there for you. And then after the surgery, they're there for you too. Some sites really have a limit in terms of the time that they can follow you. And so one of the things I always urge my patients who I wind up referring towards the Ottawa Hospital or wherever they wind up going for surgery is to take advantage of everything that they can at that site, especially when it's funded, because you'll never get that as free a service as possible under the most excellent of trained allied health and physicians. You know, that's the time to take advantage. Go to every session, go to every meeting, go to every appointment with that curiosity and wanting to learn more about what else can I do here to build my skill sets.
I love the way you phrased that. I think that's really important. And that's a big part of what Ian and I talk about as well, is like learning how to advocate for yourself and show up for yourself and really be invested in this, because it isn't a passive experience by any means. It isn't that you're going to go see Dr. Chow and she's going to fix it. And you really have to be invested on so many levels. And I was a person who I thought was very ready. And I would say I would even, I didn't feel as ready as I thought I was on the other side of surgery. Do you share that sentiment, Ian? Do you feel kind of?
Yeah, mine was my situation. Once I made the decision to go through with my surgery, it was a bit of a whirlwind. I went through the pre-surgical appointments and stuff, but then I ended up switching surgical centers because the surgeon I was supposed to see was going on like a sabbatical or something. So it was going to be like another 6 or whatever, 8 months until I could be with him. So they moved me to another center and I had surgery 2 weeks later. Like it was like,
wow.
Boom, they threw me. So it was a bit of a whirlwind. I didn't have a lot of time to kind of process that. And I think a lot of what you said about taking advantage of, you know, what those centers offer and things like that really resonated. That's something that I think is really important. I did want to jump in here because there was something that you started to talk about there that touched on one of the questions that was brought up. And so you were talking about wait times and things like that. And I know a lot of people within our community actually, they question, you know, they see those wait times, and in some provinces it can be even, you know, worse than what we've, you know, it's bad enough in certain places like in Ontario where it's, you know, maybe 2 years from point of getting your referral to the point of having surgery, maybe, or, you know, 1.5, 2 years. But in some places it could be even more, like 6, 7 years if we're talking about in Atlantic Canada, which there's a lot of people who look at that and go like, what's the point? Like, you know, should I actually be going through that? So I had this woman who sent a question in here, and she said, when would be the best time to look into bariatric surgery? She said over the years she had thought about it, but she never talked about it with a doctor because she had these episodes of successful weight loss, but then would regain that weight back, and she'd be going through these cycles. And then when she would think about it, the wait times kind of threw her off, and now it's later on in life, and she's never really considered it a realistic option. But she also mentioned, you know, maybe it's too late now. So when should people be considering that?
That's a great question. So I think if you already kind of know, or you're even just curious about surgery, it doesn't hurt to pick up the phone and call the site that will probably be your location and just say, I'm just wondering what the surgical wait times are. just so I have a sense. Because in Ottawa, I would say it's a year or less. Yeah, which is pretty awesome.
Yeah.
Yeah. That being said, I know in other provinces, you're talking years. So it doesn't hurt to just say, can we just start the referral process now? Because at least I'm getting, like, maybe when my name comes up, I'll just say, no, I'm okay. Great. At least you've opened a door. Now, I'm not trying to jam the system with, and probably some hospitals are going to be like, oh my God, what is she saying? I want more referrals to be put in. But you're playing a game here, unfortunately. This is your life, and you're trying to get access to care. And in publicly funded bariatric sites, there are limits to the number of cases they can do. And that, again, generates a wait list. Interestingly enough, I think in Ottawa, with the pandemic, referrals went down. And so when they started opening up again, the wait list wasn't that bad. It was actually pretty good. And now they're rushing to catch up. So it happens for all bariatric sites. I think things to consider. Oh, yeah.
Oh, that's okay. I was just going to say, I think you said something really important in there as well, because it was something that was brought to me when I first, started talking a little bit about surgery. I was very remiss to do it. And the physician that I was working with at the time was like, it's your call. There's no harm on being on the wait list. And then when the moment comes, your body, and that's a really big part of this, because often, again, it can feel like I have a one golden ticket opportunity, right? Because we're so used to that, like, not enough available and fighting for resources or being taken seriously in medical situations. I get both sides of it, but I think there's something very powerful in what you said there as well, that, like, we are playing a bit of a game, but that's the system. Here we are. There's no harm, no foul, but it is your choice. Ultimately, when the phone does ring, you still get a say in what you do next.
And it's not, and I know I've heard it happen, is that people who have actually, at least in Ottawa, and I'm sure it happens at other sites, they've gone through the whole process, and at the last minute, at the consent time with the surgeon, and this is months later, they changed their mind, and no one's going to be mad at you. Mm-hmm. No one's going to be mad. I think the only, like, on the flip side, the only thing I would say is, if you already are kind of 95% certain you're not going to go through with it, then maybe allow someone else to take over that position so that they can move over and get that spot and move forward. But if you are kind of, gosh, I'm pretty, then go for it, because this might be a great treatment option for you. But again, you have time. The day they phone you and say, hey, come on in, doesn't mean the next day you're having surgery. It's still months and months later. And this is a great chance to explore if this is the right option for you. And on that note, I think it's really important to be as honest as possible for yourself and also to the clinicians who are trying to help you about what's going on in your life. If there is trauma, psychological issues that need to be discussed or addressed, if there's medical conditions that they should be aware of, if there's social situations they should be aware of, if there's binge eating, that has not been addressed or divulged at any point, this is the time to do it. Because the more the team is aware of what's going on with you, the more they can say, yeah, okay, well, here are some resources, here are things that we can do, and does it make sense to go for bariatric surgery? So you don't have to go there thinking you have to be the A+ student right away. Mm-hmm. That's not often.
Yeah.
And I think the more you can be honest about what's working for you, what hasn't worked for you, then the team is there to try to support you.
Yeah, I think that's a really important point, because within not our community, our OC Connect community, but within like peer support groups that I've been involved in online for bariatric surgery, there's a lot of people that go in there and they try to cheat the system. Like, they go in asking what should they be answering, or how they should answer questions they're being asked by the social worker or by the dietitian and things like that, so that they get approved, because they're so fearful that they're going to get denied the surgery as part of that process. And it's counterproductive. It doesn't help to not be honest, like you said there. if there's underlying things that need to be addressed, now's the time to do it, so that surgery, if you do happen to go through with it, is going to be successful. If you don't deal with those things now, it's not going to be as successful as it can be, and it could cause problems down the road. So that honesty is a really, really important piece, I think.
I think the opportunity of like connecting with these sites, as you call them, these places that offer these services, is that, yeah, surgery might be the destination you think you have in mind, but there's so much learning along the way that really is so important pre, and it really does set you up for success post. So let's get back to talking a little bit about the surgery itself, because I know you mentioned with the more malabsorptive options, for example, there's risk of complications, and then complication and risk are not necessarily the same thing, but people can have misunderstandings about the surgery itself. So maybe can you help us understand, like, what is the risk, or how risky of a procedure would you consider these, and then help unpack a little bit what we mean by complication as well.
So I guess the worst complication that anyone ever has with surgery in terms of risk is death, right? Because that's not reversible. So when we look at the statistics for bariatric surgery, it's really good, less than 1 in 1,000 in terms of mortality. And this is comparable to people getting their gallbladder out, less risky than hip surgery or people who go for a coronary artery bypass, right? So, let's put that one aside, because sometimes people are like, what's the risk of my dying from this surgery? So it's really low at good bariatric sites. Then there's the potential complications, and the surgeons are always the best to talk to about this, and they will quote you exact percentages of things like bleed, or having blood clots, or having a leak. A leak is when there's a leak from the surgical site, and then hence peritonitis, etc., and potentially dying, right? But again, I just told you, death is low, very, 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 very low. But there are those kind of 30-day post-operative complications that can occur. And those are low. Like that's, they quote it maybe less than 5%. But every site that you go to will go through that. And some of them will even base it on their own statistics. And that's great, because that's what you want to hear, right? How many surgeries did my surgeon do? What's the complication rate at this site? So that's the type of kind of post-surgical complications. And then let's talk about later on, right? So later on is what a lot of people wonder about, because there's stories out there. There's great stories of people who've had surgery and great success. And then you have people like, that was the worst decision. I regained all my weight. I got this and this issue. I'm throwing up all the time. And yes, this can happen. But again, the point is to be aware that there can be these complications or things that occur, but they don't necessarily have to occur. And a lot of it can be mitigated by just picking up or thinking back of all that you learned in the preoperative phase. And a lot of the things that you learned in the preoperative phase was how to eat, okay? Balanced meals, having protein, good quality food, separating your solids from your liquids by about half an hour. And more importantly, and very importantly, is taking your vitamins, okay? So one of the risks that occur years later, or even a year after surgery, is vitamin and mineral deficiencies. And part of it has to do with sometimes people aren't necessarily taking their vitamins as they should, or they are, it's just not enough. And that's okay, because you need to be monitored for it. So iron deficiency can be one of them, calcium and vitamin D deficiency. And if you take those supplements, then it's less of an issue. And by taking those supplements, you also mitigate potential complications like osteoporosis, because that's known that can happen post-surgery. Kidney stones too, as long as you can start taking your vitamins, keep on hydration, etc. The good things about surgery, I think, trump the bad things that can occur with surgery. And the good things is that, longevity increases. And also, you can do things to other comorbidities like diabetes and put them into remission. So you're on less medications. So I just want to put that in perspective because I know this part of the conversation is about complications and I don't want to scare people. But I really do believe that the good outweighs the bad. But you do have to be aware about what can go wrong or not necessarily work in your favor. But a lot of it can be managed. Dumping syndrome is another thing that can occur, particularly after gastric bypass, one that has that kind of malabsorptive or hypoabsorptive component. But again, if you eat properly, then you're less likely to feel, this is what happens when you're not eating properly. You feel really sick and sweaty and you have to lie down. You're just like, and then a couple of hours later, your sugars might dip low and you feel really awful. That can be mitigated with good choices of food. So things that you hear badly, whether it's on Facebook or someone's journey, maybe it's because the person has forgotten some of the basic things that should have occurred. I'm not trying to blame the person, but I'm just saying that there might be an explanation behind that. And so don't get hooked by these bad stories because they exist in every scenario for anything. Just look at it like a curious science and go, oh, look, there's somebody who's had an issue. There's somebody who's done something really well. Okay. And how do I fit in all of this? So just trying to put that into perspective. One thing that has come out recently is with the sleeve surgery. There has been a higher incidence of Barrett's esophagus that was noted. This is when the esophageal lining changes, and that is considered a risk factor for cancer. So the actual, not the current guidelines, but there's been a consensus statement that's been put out about doing endoscopies, so upper GI endoscopies, visualizations every 5 years after having had the sleeve. This is new. So if you have had the sleeve, this is something you might want to discuss with your doctor, teeing up to at least have a checkup endoscopy. So again, not trying to scare people. Okay, this is not to say, oh my God, surgery causes cancer. No, it doesn't. Okay, what we're saying is we've come to this knowledge basis of this happening, and hence it's a matter of screening. Okay, so I think the wins outweigh the losses, but it's good to know. And these are great conversations to have with your bariatric team as you go through the process of whatever surgery that you decide to go through.
Yeah, and I think, again, another really important piece that you said there was that a lot of this stuff can be mitigated by following through with your postoperative care or like remembering the things that you learned in the preoperative program. Today I'm almost 8 years out from my surgery now. So I'm no longer followed by my bariatric team, but my general practitioner now follows me. And so like today, I actually had to go and do my full bariatric panel of blood work, and that's a good reminder. I haven't been exactly on point with my vitamins. I'm going to now because it was, a good reminder. I had that conversation with him and I kind of, it wasn't completely off my vitamins, but I wasn't perfect. So, you got to manage that post-operatively and make sure that you're following through with all those things that you learned along the way. I think that's really important.
And I always, like to remind us that we're so steeped in diet culture. Everybody thinks it's just eat more, move less. It's time. I love the way you're phrasing this as well. Get curious about the disease you live with, get curious about possible solutions, get curious about how your physicians and the people you work with think about it, look at it, where are they, you know what I mean? Like it's good to get curious and ask all these questions and arm yourself so that you really can feel confident in the decisions that you're making. And I think that leads really well into the next kind of question and point that I wanted to go to is, we hear a lot from our members as well, and we've brought up shame already and stigma, that there seems to be a lot of shame and stigma associated with bariatric surgery, especially when you have family members or friends or just that general happening around us, that it's kind of implied that we're taking the easy way out. How do you approach that with individuals that you work with clinically?
It's tough because that weight bias exists. And, I think ultimately, as much as we try to educate people about weight bias and this is a chronic disease, the message is not fully out there for all the community or for a reception from them, right? Like it doesn't necessarily steep into their brain. So for a patient who's sitting in front of me and says, I'm getting this attitude from the people around me, it's like a storm, right? You can't control that storm. All you can do is just anchor yourself. But then you anchor yourself in the knowledge, and this is why it's so important to connect with a clinician who understands bariatric medicine, or at least somebody else who's gone through surgery or through this type of webinar, that for gosh sakes, you've worked hard. You've worked super hard at weight management in multiple things. And this is the treatment option for you. This is just one of the treatment options for you that is going to work. Okay, because I'm going to believe that it's going to work for you, because you need that tool. You need that. It's not to say that you failed. I always call this, when we talk about bariatric surgery or when we talk about anti-obesity medication, it's there to complement the hard work that you've been doing. Complement. It's not, you haven't cheated, you haven't failed, because you've been working hard at it all of your life. And this is now where we're directing our attention. So yeah, the storm that's happening around you just got to anchor yourself down and recognize too. And this is where I think compassion is huge both ways. So yeah, we'd love to have the compassion from those relatives or people who are saying, come on, you just got to eat less, move more, duh. They're not educated, so let's have some compassion for them. They need that education, and maybe you can provide it to them. And I also I like to believe that all humans try their best, and perhaps they're trying to give you that advice with all good intentions, right? They want the best for you. So ultimately, we're all there just trying to make you as healthy as possible. People's advice, I'm going to call it again, advice doesn't always make sense. And you've got to appreciate that and just, acknowledge and then distance yourself from it.
I've had some interesting conversations around this one. And I can educate people about obesity as a chronic disease. I can have those conversations, and I'm usually pretty good at being convincing with that stuff. But when someone says, you had surgery, that's just cheating. When it comes to your health, I think, it's not cheating, and we can make that argument, but really, when it comes to your health, wouldn't you cheat if you could? If I'm going to live longer, what does it matter in the end?
So the analogy here that I draw is, again, this chronic disease model. And if we think about people who have angina or coronary artery disease, and initially they're trying lifestyle measures. They're trying to take care of their cholesterol through good eating habits, etc. And maybe it's not good enough. So then medications come into play and they go on medications. But the angina is still there and it's getting worse, even though they're doing all their best efforts. So the person moves on towards a surgical intervention, and that can be a coronary artery bypass graft, so a CABG. Feel guilty about that? Nope.
Yeah.
That was the treatment for me, because otherwise I would have died of a heart attack. Yeah. So this is how I view bariatric surgery.
Yeah, that's good. I think that actually ties into the, being mindful at the time, tying into where we're going to be going next. And it's, how does bariatric surgery fit into the overall obesity management picture? I think that's something important. And for you, you're the author on one of the lead authors on the post-operative bariatric care. I think you're in a really good position to explain, how does bariatric surgery fit into that larger picture? Because it is a chronic disease. It is something that we are going to have to manage for the rest of our lives. Mm-hmm. There's stuff that we've done pre-surgery. There's stuff that we're going to have to do post-surgery for the rest of our lives. So maybe just touch on that a little bit.
Yeah. Bariatric surgery, I think, will always be the most intensive option for weight management, because obviously it involves a lot of surgery and change of the anatomy, right? And even though there are some pretty powerful medications that are coming out, and it's pretty exciting time now for us that are not doing surgeries. I don't do any surgeries, by the way, full disclosure.
Yeah.
I don't like blood. So I don't do surgery, but we're exciting times because there are some new medications that are coming out that have some double-digit % weight loss. So I do think that the medication options are growing, and hence bariatric surgery is going to move more and more to those that have a hypoabsorptive component, that have a bypassing of the tract of the intestine. And we're going to see a shift of those people who have tried everything. They've tried the medications, they've tried lifestyle, they've tried meal replacements, whatever it is. And they have a strong genetic component for weight in their family. I think a key thought is, if you have a first-degree relative who's had bariatric surgery, this might be an option for you too to consider, because that's what your relative needed. That might be something that you need. I think because we're so limited in the number of surgeries in Canada, it will probably become that option where people have tried everything from a medication perspective at some point, because again, the medications are getting into those double-digit % weight loss, and then the surgery will become really the most intensive one. So we need bariatric surgery. But there's only like 10,000 to 12,000 surgeries done in Canada, and there's probably 1 million people in Canada that could qualify for surgery. So it just becomes, a little bit more selective. Hopefully we grow the number of bariatric surgeries that can be available and accessible to all. The beauty of the Canadian guidelines is that it acknowledged that bariatric surgery wasn't just for people who are at a body mass index of greater than 40 or body mass index of 35 to 40 with a comorbidity like diabetes, but it then said, hey, if your BMI is between 30 to 35 with an uncontrolled comorbidity such as uncontrolled diabetes, you should consider bariatric surgery, because you should have it earlier, sooner than later. But again, we're lacking in resources, right? There's 1 million people out there who at a BMI greater than 35 are waiting to have or could qualify for surgery. So how do we get those people who are at a smaller body weight but still could benefit from surgery? I don't think that's the best answer I can have. All I can say is that bariatric surgery is so important as a treatment option for obesity. And we have to be able to grow that service.
Yeah, and it's definitely something that at Obesity Canada we've advocated for, and we're working towards. We've with what you just talked about there, with the guidelines, the recommendation for uncontrolled diabetes and having a lower BMI. That's something that we've actually worked to get a health technology assessment kind of for the province of Ontario to look at it, to change their recommendations to be in alignment with the guidelines, so that people that do have a lower BMI but uncontrolled comorbidities can have access.
Yes, I know about that one, because I volunteered my colleague.
Perfect. I think
he totally wanted to do it, so that's great. Dr. Harris, he's awesome.
I think another really important question that we wanted to get to, that I wanted to talk about, was what does long-term success for someone with bariatric surgery look like? And for someone who works with post-bariatric patients, what is it that you're looking for?
So long-term success in my mind is that you're at a weight that's sustainable, and that you're healthy, and that you are nutritionally replete, so you've got all your vitamins on board, etc. A lot of people will look at long-term success as the number on the scale. And of course, right? Of course. I mean, you've worked hard at trying to lower weight, and you've stepped on the scale, and that's your measure of what a success is. Hey, I lost 10 pounds this month. I lost 5 pounds this month. Oh, I didn't lose anything this month. Oh, I gained 3 pounds. What? So ultimately, with bariatric surgery, when we look at the % weight loss, and I said anywhere between 20 to 40%, I think you have to go into bariatric surgery with understanding expectations. Often people go in thinking there's a number on the scale that they want to get to. And if they don't get to that number, then they're disappointed. But to put into perspective, let's say I have a person who is 300 pounds preoperatively, and they lose 20% of their weight, and they reach their lowest weight somewhere between a year and 18 months post-surgery. So what does that mean, 20%? That's 60 pounds. So that takes you to about 240 pounds. And that's your lowest weight post-surgery. What if you're 40%? Then that's lowering by 120 pounds. And so that means you reached 180 pounds at your nadir, the lowest weight at 12 to 18 months post-surgery. So that isn't 115 pounds. That's not 120 pounds. That's not being that super skinny model on a magazine. You have lost weight. And it is really normal after you've reached that lower weight where you've hit that kind of lower nadir, that, weight might creep up a little bit. There's a normalcy in that. So part of understanding the expectations or realistically understanding the trajectory of weight management is important when you approach surgery, because it's not going to make a person model thin, super skin. You hear some stories, and yeah, there are people that we call super responders. And maybe they keep their weight off a little while, but then the weight starts creeping up again. And so be it. That there's a normalcy in that. What happens if you don't like it when you're starting to gain weight? Good time to talk to a bariatric site or your physician, even if they're not in bariatrics, because again, maybe it's a refresher time. Maybe it's my checkup time. Maybe I need to do my blood work. Maybe I need to take my vitamins, remember to separate my solids from my liquids. Or maybe I qualify for something like a medication. And we have some data out there about the use of medications post-surgery. A lot of it is retrospective, not like in randomized controlled studies, but that might be another tool that can be used to help somebody manage their weight. So ultimately, the way I see success in weight management is when somebody can live their life. They're kind of monitoring a little bit the weight just to have a sense, just to help guide. When the behaviors start to drift, it helps to just pull you back in. I was on vacation, I gained 5 pounds. I know what happened. I'm just going to get back into that routine that was before the vacation. So when that drift occurs, it helps pull you in. So then you use your scale as a friend, just to monitor, maybe once a month, maybe it's once a week. Some people like to do it daily, but just be kind to yourself. Remember, that scale can change within a day, right?
That's that is such an important part of this. And I think, Ian and I have talked about it many times about those, support groups that you might be in from a surgical center, and how isolating it can feel when you hit regain land. And if you're not an early responder as well. And I think it's very important to Ian and I as well to make sure that people who may have moved themselves through the process of getting bariatric surgery, if they still have questions, they still have needs, this is a chronic disease that you're going to need support with for life. And there is no shame in showing up again and asking for that help again and exploring more options. Might even mean additional surgery, might mean medication, to your point. Maybe it's just a refresher in some of those CBT therapies, but none of that is off the table. And I think that's something that I am very passionate about, making sure people understand.
Yeah, and I think for me, post-surgery, I really learned that I had to, getting back to honesty, I had to be honest, and I explored all these other things, because I had that honeymoon phase for the first 2 years, and then I had my regain, and then it kind of got into a panic mode about what am I going to do? I'm failing this opportunity that I've been given. And so I got into a bit of a panic mode, and it was just, reaching out, learning more, and addressing some of those underlying issues that maybe, I don't want to say they popped up post-surgery, but maybe they became more to the forefront post-surgery. So dealing with the, cognitive behavioral therapy or things like that, issues around binge eating and stuff like that. Those are all things that I never even considered pre-surgery, and I had to deal with them post-surgery. And again, to Lisa's point, showing up for yourself, and that's something you're gonna have to continue to do. And just being aware, open, and honest, I think is usually the thing that helps. And to speak to a little bit about success, I'm one of those people who I despise the scale. I use it as little as humanly possible for myself. I measure success with, like you said, living your life. And, you know, I wrote a blog a couple of years ago about my experience with surgery. And one of the things I mentioned was my measure of success is my family, my kids, and the things that I can do. Pre-surgery, I couldn't do the things that I wanted to do. I couldn't be the active, fun dad that I wanted to be. I was having trouble with, you know, motivation to get up and do things, or having the energy and dealing with pain and those sorts of things. I now coach multiple sports teams. I'm on the ice with my kids like a couple times a week, or I'm on the baseball diamond and those sorts of things, making memories. And that's success to me, which I think is really important. I think people need to also think about those little things, and that's important.
It can be such a big hill to climb because we're so used and so conditioned to just thinking in terms of scale. But I think you said this early on as well, Dr. Shao, is, you know, I think the tides are changing a little bit. The narrative out there is changing a little bit around obesity as a disease, and also people understanding body diversity, and also appreciating that if this is a chronic disease, who am I to override my genetic makeup? Or as my boyfriend said to me, you had surgery, you didn't get a superpower. Slow your roll, right? Like, so, which is fair as well. You know, we think we can then just, you know, fly even higher. And it's like, you know what? I'm good. I was a person who I didn't think I had lost enough a year after surgery. And in one of my year out appointments, I did mention to my doctor that I did shave, I think it was 2 minutes off my 5K time or something like that. And he was like, okay, can we slow down and talk about that for a second too? Like, and really connecting those dots to those things that really do fill your bucket. And I know it's so easy to say in the moment I'm in now, but it really is, it makes such a big difference in this journey of, you know, exploring bariatric surgery and then living life really awesomely post-surgery as well. Oh, this is amazing. Sorry, I think we've gone a little bit over time. And as we said at the top, we knew there were going to be a million tentacles that this could go in, but so appreciative of all of the conversation today. And I'm super appreciative of that mentor that you had at the very beginning that said, there's nothing, do you want to make something? Because I think you've made something pretty epic and amazing. And I thank you for all the work you're doing and for sharing it here today with us, for all the work you're doing for that next generation of care as well. And for being another point of reference out there in the world that there are people open to these conversations, interested in working with people living with obesity, and really just want to help and understand and get it. So thank you so much.
Thank you for having me.
Of course. For everyone else, we will definitely be continuing these conversations in our connected community. So feel free to join us there. As Ian said, hopefully you guys have used the chat and the question features watching this. If you haven't, feel free to pop us questions over in the connected community. We look forward to continuing these conversations. So with that, I will say, take good care, everybody. Be kind to yourself and at least one other person. Remember to wash your hands. And I hope you have an amazing vacation, Dr. Shao. Thanks, everybody.
Take care.